My name is Narda Immaculate, and I'll be doing my remediation for the dressing change and using salinity technique video, skills video. I gather my supply, I have my package, my sterile package, I have my normal gloves, and then I have my patient with the dressing wound that has been an old dressing. I provide for privacy. After providing for privacy, I come and introduce myself. Hi, my name is Immaculate, and I'll be your nurse today. I ask my patient for 2 identifiers. Could you please tell me your first and last name? After asking for the 2 identifiers, I ask for any allergies. After asking for any allergies, I explain my procedure. After explaining my procedure, I ask for consent or I thank my patient. When my patient says yes, then I thank them for allowing me to do change. After that, I put on my I perform hand hygiene. After performing hand hygiene, I apply my clean gloves, my normal clean gloves. After I've applied my normal clean gloves, and then I remove my old dressing from my patient's wound. I make sure that I don't hurt my patient. I perform it in a parallel way with the full, and then after that I trash my bandage, my old dressing bandage. After that, I inspect my wound. I inspect for tissue type, any color or any odor or any drainages. Hi, Miss Lee, I'll be inspecting your wound to check for any color, for any odor, or for any drainages. Okay, after I'm done that, I take off my gloves. And I trash my gloves. After I've done finishing trashing off my gloves, I now apply my sterile. I perform hand hygiene again. After performing hand hygiene, I now take my sterile glove package. I peel it off, make sure that I don't touch on the inside, and then I roll it over so it doesn't touch the inside. So after I'm done, make sure that it's facing me. After I'm done opening my package, I collect my sterile gloves. I make sure that I only touch that. I don't touch any other item. I create room for my sterile gloving, and then I open my package. After I'm done opening my package, I make sure that I only touch the 1-inch border on my sterile gloves with the 1-inch border and open it. I don't touch on the inside. After I'm done opening my package, my sterile package, I get my non-dominant hand, which is the left hand, and then I pinch, like a pinch, sure that I keep the cuff on. So I still have my cuff on, and then I get my other 2 fingers, make sure that my thumb is up high, it doesn't touch, and make sure that it doesn't. So I'm done, still have my cuff on. After I'm done with that, I pinch into my cereal package and then trash it away. After I'm done dressing up and I'm ready now for the procedure, I make sure that I have my dominant hand, which is the right hand. I pick using my stereo hand, that's my left hand. I pick my cleaning swab and then drop it in my right hand and then clean my wound from inside out, and then I trash my swab. After I have trashed I trashed my swab into the trash can. Then I get my dry gauze using my left hand. This is my stereo hand. I drop it in my right hand. Then I'm like, okay, Miss Lee, I'm going to dry off your wound, inside out. I don't go back. And then I trash my gauze and drop it in. And then after that, I grab my Tagaderm on the inside, Tagaderm, and then I peel it off. Sure. So those are two. So I make sure I just drop one down. I don't put it down, back inside because it may contaminate the rest of then I trash, then I open. And I rub my wound. All right. When I'm done dressing up my wound, I time and date my dressing change, and then after that I take off my gloves. I use one of the hand, pinch it, and then after I get my two hands, and then I trash my gloves. After I'm done, I then clean up my table. After I'm done cleaning up my table, I perform hand hygiene. After cleaning up my hand hygiene, I thank my client or my patient for helping me, for letting me do this. Thank you for letting me perform the dressing change on you. After I'm done, I document my procedure. That's it. Thank you so much.